Hello, I'm Nia,
And I'm Janae.
and we're going to talk to you guys today about leukemia. So, what is leukemia? Leukemia is a cancer of the early blood-forming cells and is caused by the rapid production of abnormal white blood cells. These abnormal white blood cells are not able to fight infection and impair the ability of the bone marrow to produce red blood cells and platelets. Leukemia can either be acute, which is fast-growing, or chronic, which is slow-growing.
So the four major types include chronic myelogenous leukemia. Is a type of cancer that mainly affects adults. A person with CML may have few or no symptoms for months or years because it's such a slow-growing cancer. This type of cancer is marked by a chromosome change where chromosome 9 and 22 break off a piece and trade places with one another. It's called the Philadelphia chromosome. You also have CLL, chronic lymphocytic leukemia. It's the most common chronic adult leukemia, and it's also another type of slow-growing cancer where you have too many immature lymphocytes. They're found mostly in the blood and bone marrow, and with this type of leukemia, the patient may feel well for years without needing treatment. You have acute myelogenous leukemia, AML, the most common type of leukemia occurring in children and adults. AML is aggressive, fast-growing, and which too many myeloblasts are found in the bone marrow and blood. If they were to do a blood smear, it may look similar to this, where you see the white blood cells overcrowding the red blood cells. Lastly, you have acute lymphoblastic leukemia, ALL. It's the most common type of leukemia in young children. And again, you have a number of leukemia cells increases in the blood and bone marrow to where there's less room for the healthy white blood cells, red blood cells, and platelets. This cancer can also spread to the central nervous system.
So, what are some risk factors of leukemia? So, there actually is no obvious reasons why people develop leukemia, but researchers have come to show that radiation exposure, like a survivor of an atomic bomb, has some increased risk of leukemia. Previous cancer treatment, genetic disorders like Down syndrome, exposure to certain chemicals like benzene, smoking, or a family history of leukemia, an immediate family member, so like a sibling or a parent. So a study that we found was on the incidence of breastfeeding in childhood leukemia. So a meta-analysis was done using 18 studies that met certain criteria and would compare it to with no or babies that are breastfed for less than 6 months. Those breastfed 6 months or longer was associated with a 19% lower risk for childhood leukemia. With this, and based on current meta-analysis results, 14 to 90% of all childhood leukemia cases may be prevented just by using breastfeeding for 6 months or more. So some signs and symptoms of leukemia can vary depending on the type of leukemia. So some common leukemia signs and symptoms include fever or chills, persistent fatigue, frequent or severe infections, losing weight without trying, swollen lymph nodes, like we have here, a swollen lymph node versus a normal lymph node. It is a big difference in size. Easy bleeding or bruising, anemia, recurrent nosebleeds, excessive sweating, or even bone pain or tenderness. So how do we diagnose leukemia? So your doctor will do a physical exam looking for physical signs of leukemia like pale skin, anemia, swelling of the lymph nodes, or an enlargement of your spleen or liver. Also a blood test, so a blood smear. By looking at a sample of your blood, your doctor can determine if you have abnormal levels of red or white blood cells. Like the picture Janae showed, a normal smear versus a leukemic one, which has white blood cells that are overcrowding the red blood cells. Also a bone marrow test. So your doctor may recommend a procedure to remove a sample of bone marrow from your hip bone. The bone marrow is removed using a long, thin needle. The sample is sent to a laboratory to look for leukemia cells, DNA markers, and chromosome changes in the bone marrow. So how do we treat leukemia? So the major form of treatment for leukemia is chemotherapy. This drug treatment uses chemicals to kill all rapidly growing cells. Depending on the type of leukemia you have, you may receive a single drug or a combination of drugs. These drugs may even come in pill form or may be injected directly into a vein, so coming into like a center to get chemotherapy. Another treatment is biological therapy, which works by using treatments that help your immune system recognize and attack leukemic cells. Another form of therapy is targeted therapy, which uses drugs that attack specific vulnerabilities within your cancer cells. For example, the drug Gleevec, which stops the action of a protein within the leukemia cells of people with chronic myelogenous leukemia. And lastly, radiation therapy. Actually, not lastly, because we're going to talk about stem cell transplants as well. But radiation therapy uses X-rays or other high-energy beams to damage leukemia cells and stop their growth. During radiation therapy, the patient will lie on a table with a large machine that moves around, directing the radiation to precise points on the body.
So radiation can prepare the body for a stem cell transplant where they replace your diseased bone marrow cells with healthy bone marrow tissue. Before a stem cell transplant, patient must undergo a process called conditioning where the bone marrow, essentially their immune system, is completely destroyed. This is essential in order for the new stem cells to take effect and start producing new mature white blood cells, platelets, and red blood cells. Conditioning is also very dangerous because, again, you're wiping out their immune system. So a lot of patients can die during this process. In an article on hematopoietic stem cell transplant, it talks about how there are negative psychosocial effects on the patient because of this process, and it's very distressful. So a way to decrease the stress from this patient is for the interdisciplinary team, such as the nurses, the social workers, the doctors, and chaplains, and everyone that works in the hospital, to collaborate, work together, and communicate to help this patient through this process. So a couple nursing diagnoses related to leukemia. You have risk for infection related to immature white blood cells. You have risk for deficient fluid volume related to excessive losses through vomiting and diarrhea. Acute pain related to enlarged lymph nodes, and also activity intolerance related to imbalanced oxygen supply and demand. So a couple nursing interventions to go along with those. You definitely want to educate the patient and your loved ones about infection prevention. Everyone has to be on the same page. Wash their hands. Don't insert Foley catheters, injections, lines, and tubes unless it's absolutely necessary. These are invasive procedures and increase the risk for infection for the patient.
So an article we found was on subcutaneous immunoglobulins in oncology clinical practice. So the administration of gamma globulins as replacement therapy to boost immune function in patients that are immunodeficient is traditionally given in the IV form. The purpose of this study was to promote a pilot program at a large Canadian cancer center that was led by an advanced practice nurse that taught patients how to self-administer sub-Q immunoglobulins at home. The results of the study led to savings and benefits for not only the patient, but also the institution.
Also, relating to infection susceptibility, you're going to look at your patient's neutrophil count. Anything below 500 is going to be an increased risk of infection. The American Society of Clinical Oncology, they have revised their evidence-based practice, and they recommend that broad-spectrum antibiotics be started within 1 hour after fever onset or blood cultures have been obtained to treat the infection. Nurses are not advised to wait until the results from the blood culture unless otherwise directed by the doctor. Another way to prevent infection is you want to do what they call sepsis surveillance. You're going to be looking for fever, mild hypotension, and tachycardia, the three main symptoms that usually present when sepsis is occurring. You're going to go ahead and start them in fluid resuscitation as well as the antimicrobial agent. You also want to prevent skin breakdown for these clients. Again, your skin is your primary defense, so that increases their chance for infection. Initiate bleeding precautions. Low platelets, they're likely to bleed out. And also cluster their care to conserve their energy. Help them with a walker, wheelchair, shower chair, a cane. Cluster your labs, draws, and vitals and other aspects of care together if you can, because these clients are going to be suffering from fatigue. You're going to closely monitor eyes and nose, assess for signs of dehydration, skin turgor, mucous membranes, capillary refill. And also, the main thing is to stay above the pain, stay ahead of the pain. Going through cancer and chemotherapy is very painful. A study found that massage, specifically a slow stroke back massage performed about 60 strokes for about 3 to 10 minutes can really help with pain, fatigue, and sleep disorders. Those three things are related because pain affects your sleep. Your decreased quality of sleep will make you more fatigued and weak.
So what are we going to teach these patients? So, of course, number one is preventing infections. Like Janae said, we want to make sure that as nurses that we're looking out for sepsis, but make sure that we're very adamant about hand washing and neutropenic precautions and things for these types of patients. We also want to the patients take care of their mouth and gums to prevent mucositis. So flossing daily, cleaning the toothbrush by rinsing it well after you're brushing, rinse with chlorhexidine, which is a medicinal mouthwash, in the morning, after meals, and at bedtime. You want to avoid sweets, juice, and soft drinks except at meals. For comfort, when the mouth is dry, you want to use plain, unflavored water to moisten those mucous membranes. Also, we want to teach the patient about eye care. Some people experience changes in their eyes or vision following bone marrow therapy. Also, you want to talk about flu and other vaccines. Since immunity to common viral pathogen risk being seriously impaired from chemotherapy and the immunosuppressive effects of drugs or disease, revaccination is usually recommended for all patients. Also, a big thing with these patients are nutrition. You want to have them drinking lots of fluids to help minimize mouth dryness. If the patient's mouth is sore, cool, or room temperature drinks are often more soothing than hot ones. Also, you want to let them know to avoid spicy or acidic drinks such as grapefruit or orange juice if the mouth is sore. You want them to choose foods that are soft, moist, and easy to chew and swallow, such as ice cream and popsicles. These patients also have some issues with nausea and vomiting, so you want to have them eat foods that can help with that. Also, exercise. Have these patients walking in the hallways. If they feel unwell, do what they can. A short walk several times a day is better than only one big long walk. And lifestyle changes. We want to prevent bleeding and bruising by using an electric shaver to shave, not playing contact sports, using soft toothbrushes, not taking NSAIDs or aspirins. And thank you. We hope you enjoyed.